Respiratory drugs. Hey everyone, welcome back to Nursing and Me. Today, we're diving deep into respiratory drugs, the medications that help with conditions like asthma, COPD, allergies, and the common cold. Before we get into the details, let's first clarify two important terms you will hear throughout this video: adrenergic and cholinergic. Adrenergic drugs stimulate the sympathetic nervous system, also known as the fight or flight response. This system helps open the airways, increase heart rate, and reduce mucus production. On the other hand, cholinergic drugs activate the parasympathetic nervous system, known as the rest and digest response, which increases secretions, slows the heart rate, and can cause bronchoconstriction. Understanding this will help you easily grasp how these medications work. Now, let's get started. First up, antihistamines. These are the go-to drugs for allergies and colds. Histamine is a chemical your body releases during allergic reactions, causing sneezing, watery eyes, and itching. Antihistamines work by blocking H1 receptors, preventing histamine from triggering these symptoms. First-generation antihistamines like diphenhydramine, Benadryl, cause drowsiness, while second-generation antihistamines like loratadine, fexofenadine, and cetirizine are less sedating. These medications are commonly used for allergic rhinitis, urticaria, seasonal allergies, and common cold symptoms. First-generation antihistamines can cause sedation, dizziness, dry mouth, and constipation, while second-generation options have fewer side effects, mainly headache and dry mouth. Educate patients to take first-generation antihistamines like diphenhydramine at night due to their sedative effects, while second-generation antihistamines like loratadine and fexofenadine are better for daytime use because they cause less drowsiness. Patients should also avoid alcohol or other sedating medications when taking first-generation antihistamines. When nasal congestion strikes, decongestants help by shrinking swollen nasal blood vessels, making it easier to breathe. Adrenergic decongestants such as pseudoephedrine and phenylephrine stimulate alpha receptors to constrict blood vessels, while anticholinergic decongestants like ipratropium block acetylcholine to reduce mucus production. Corticosteroid decongestants like fluticasone and budesonide work by reducing inflammation over time. These medications are commonly used for nasal congestion due to allergies, colds, and sinusitis. They may also be used before surgery to reduce swelling. Side effects vary depending on the type. Adrenergic decongestants can cause hypertension, tachycardia, and insomnia, while anticholinergics may lead to dry mouth and blurred vision. Corticosteroids can cause nasal dryness and irritation. Educate patients to limit nasal decongestant sprays to 3 to 5 days to avoid rebound congestion. Patients with hypertension or heart disease should avoid adrenergic decongestants as they can increase blood pressure. Now, antitussives. If you have a dry, non-productive cough, antitussives are the medications that help suppress it. Opiate antitussives, such as codeine and hydrocodone, act on the medulla in the brain to suppress the cough reflex. Non-opiate antitussives, like dextromethorphan and benzonatate, work by numbing stretch receptors in the airways. These drugs are used for non-productive coughs and post-surgical recovery to prevent stress on sutures. Opiate antitussives can cause respiratory depression, constipation, and drowsiness, while non-opiates may lead to dizziness, nausea, and mild gastrointestinal upset. Educate patients to avoid driving or operating heavy machinery when taking opiate antitussives due to their sedative effects. Patients with a history of opioid abuse should avoid these medications. The other respiratory we have is expectorants. These drugs are for coughs that bring up mucus. Expectorants help by thinning and loosening mucus, making it easier to expel. Guaifenesin is a common drug that we found in this category. It increases respiratory tract hydration to facilitate mucus clearance. These medications are indicated for productive coughs caused by colds, bronchitis, or respiratory infections. Side effects may include nausea, vomiting, and dizziness. Educate patients to drink plenty of fluids while taking expectorants, as hydration enhances their effectiveness. Bronchodilators are essential for managing asthma and COPD as they work to relax the bronchial muscles and improve airflow. There are three main classes. Beta-2 agonists, such as albuterol and salmeterol, stimulate beta-2 receptors to cause bronchodilation. Anticholinergic agents, like ipratropium and tiotropium, block muscarinic receptors to prevent bronchoconstriction. Xanthine derivatives, including theophylline, work by increasing CAMP levels, which helps relax the airway muscles. Educate patients using albuterol that it is a short-acting bronchodilator for acute asthma attacks, while salmeterol is a long-acting bronchodilator meant for maintenance therapy and should not be used during an acute attack. Non-bronchodilators, this are leukotriene receptor antagonists, such as montelukast, zafirlukast, and xyluton, work by blocking leukotrienes, which prevents bronchoconstriction, inflammation, and mucus production. These medications are used for long-term asthma control, allergic rhinitis, and prevention of exercise-induced bronchospasm. Patients taking xyluton should have regular liver function tests, as it can cause liver toxicity. Corticosteroids such as fluticasone, budesonide, and methylprednisolone are another class of non-bronchodilators that work by reducing inflammation in the airways. Educate patients using inhaled corticosteroids to rinse their mouths after each use to prevent oral thrush. Long-term use of systemic corticosteroids can lead to adrenal suppression, hyperglycemia, and osteoporosis, so they should only be used under medical supervision. That wraps up our deep dive into respiratory drugs. We covered everything from antihistamines and decongestants to bronchodilators and corticosteroids. I hope this breakdown makes it easier to understand how these medications work and when they are used. If you found this helpful, don't forget to like, comment, and subscribe for more nursing and pharmacology content. Let me know in the comments if there's another topic you'd like me to cover. Until next time, stay curious and keep learning. See you in the next video.